Humana Dental and Vision webinar. Presented September 30th, 2020.
All right. So, what we're seeing these days is that employers are facing, obviously a lot of problems, and some of those are due to COVID. But more so than that, right, there's a crazy increase in periodontal disease. There are tons of health and wellness problems that are associated with periodontal disease that I think a lot of people don't realize. Members or people with periodontal disease have almost a twice as likely. So obviously there's higher medical costs associated with periodontal disease, but for employers, probably the most important, thing to discuss regarding periodontal disease is the loss of productivity. So with that, welcome to Humana Dental. So a lot of people view Humana as a medical carrier, and we are proud of that. But Humana is a big player in the dental world. We have national network for dental and vision. I don't think there's many places that you can't find Humana Dental Network. I mean, we are all over the country. We've actually just brought on internally 17 more people focused on ancillary only sales throughout the United States. So let that be known that, we are here to stay. We are growing our network constantly. And, no matter where you're located in the United States, I think you'll, have success selling Humana Dental. Currently, we have just under 3.5 million dental members. We really focus on preventive care, right? We want to solve the problem or eliminate the problem before it starts versus treating the problem on the back end. That, creates better results for the members. And ultimately Humana, right? And as you as agents, because, people are taking care of their health. We have, like I said, a national PPO network that offers significant in-network discounts. And then we have recently updated benefits, including our extended annual max. And I'll get into that later. I have a whole slide dedicated to it because it's truly a differentiator for us. And I think it's a gem hidden in our plans that A, not a lot of people know about, and B, is hard to spreadsheet. But then we also have the unlimited annual max. I know quite a few agents that work with HPS sell the unlimited annual max, and we were the first. I don't think we're the only ones anymore, but we came out with that, and we've had such tremendous success selling that unlimited annual max plan because it provides total peace of mind. And it increases the rate to 8%, give or take. When you're talking about dental premium, that's $1 or $2. So to add that in for complete and total peace of mind has been a huge differentiator for us. As I mentioned, we're big on preventive care. So we have 4 periodontal cleanings a year covered in preventive on top of our 3 standard cleanings, and those don't cross-reduce. So there are 7 cleanings for our members each plan year that they have, they can utilize with $0 out-of-pocket expenses. And then additionally, we provide oral cancer screenings also in preventive. I know a lot of other carriers don't do those, or if they do, there's an additional cost associated with our Humana plans that is built in to your checkup. So, people, when you think about dental health and oral health, you're thinking about, your mouth only, right? There's actually, people say, the eyes are the window to the body. The mouth is as well, really. There are so many diseases, as you can see on the screen, that are associated with your mouth that people might not realize, including high blood pressure, diabetes, osteoporosis, and even rheumatoid arthritis. So taking care of your teeth, and I know that you know this, and I know I'm preaching to the choir, but if you can take this message to your groups, to your employers, so they can see that it's more than just getting teeth clean or not having cavities, I would consider this a success. All right, so shockingly, 40% of the U.S. population does not have dental coverage. 95% of people know that dental visits keep them healthy. 85% of people feel that they should visit the dentist. But people are, concerned about cost. And really, when you break it down, paying your premiums, the way Humana has them priced, costs less to pay that premium annually than it would pay to go to the dentist twice out of pocket. So, we try to make our dental insurance really, really affordable, but also loop in all of these benefits that I'm going to get into to kind of set us apart from the rest. All right, so what is our solution? A, make it affordable, right? B, broaden coverage. We want everyone to have coverage, A, across the nation, but B, coverage that they can actually use, preventive services that are rich in benefits. We want to improve well-being and then, again, encourage utilization. So, as a review, I did mention our unlimited annual max. I'm going to get into the extended annual max. We do have an implant rider that can be added for groups of 10 or more. Oops, there's a typo on here. It says 4 perio cleanings and 2 regular cleanings. It's actually 3. Preventive services do not count towards our annual max. And then you also have the ability to split endodontics and periodontics. So we see, quite a bit. I think I mentioned 47% of the population has periodontal disease. So that's something, I strongly encourage you to have in basic. So you're getting, lower out-of-pocket costs for that service. But endodontics, 1 to 2% of the population use that annually. So, cost is a concern. You can split endo and perio, put perio in basic, endo in major, save about 5% off the rates, and give your groups, the coverage they'll utilize the most. So, in addition to all of those, benefits that we've talked about, we do have some new enhancements to our dental plans. So we're covering periodontal exams every 2 years, whereas standardly it was 3. We've expanded the age limits on space maintainers. So our cutoff used to be 14 years. We bumped that up to 15. We've bumped up the age limit on fluoride treatment to 16 years. Again, the periodontal cleanings and the 3rd cleaning. And as I mentioned, I'm going to spend some time going over our unlimited annual max. So what is an extended annual max? What is an extended annual max, right? So let's say you have a dental provider that is not Humana and you need a bunch of dental work done. So you get a couple crowns and all of a sudden you've hit your $1,000 annual max. Now what, right? So with a carrier that's not Humana, once you hit that annual max, that provider no longer has to charge the contracted rate. So the provider can charge whatever they want to charge you for that crown. However, if you have Humana insurance, you have a $1,000 annual max, and you hit that annual max, because we have our extended annual max built in, the provider has to continue to charge our contracted rate. And then on top of that, we will pay 30%. And that is indefinite. So, it's almost like an unlimited annual max for the price of a $1,000 annual max. And you can see the example on the screen. Let's say this is for a crown, okay? So our contracted rate, let's say it's $1,000 and our contracted rate is $700. On top of that, we'll pay an additional $210. So with Humana, a member may pay $490 versus $1,000 with, going to that same provider without having the extended annual max. This is huge for us. This is built into every single dental plan at no charge. It's nothing you have to add. It's just there. So although I know everyone loves the truly unlimited annual max and it is great for peace of mind, rest assured that if you sold plans that don't have the unlimited annual max, that your members are in really good hands because they do have this continuous coverage built in. So I want to stop and see if there's any questions on that. I try to explain it well, but let me know if there's anything, that you want me to cover or you don't understand, and we can go from there. And if there's not, then we'll just keep going. All right. So, as I mentioned, and I keep pounding on periodontal disease, more than 47% of Americans suffer from periodontal disease. Most other providers only offer 2 periodontal cleanings per year, even though the ADA recommends 4 cleanings. And again, because we're all about prevention and wellness, we've upped our periodontal cleanings to 4 in preventive. It's not covered in basic like most carriers do. We cover it in preventive. And again, like I said, it's all about the preventive services, right? So you all know, or maybe you don't know, that we base our employer-sponsored or voluntary rates on participation, right? So we don't care if the employer isn't paying for the dental or the vision. As long as there's 50% participation, minus the valid waivers, we'll give the group employer-sponsored rates. There's a really cool caveat built in that not a lot of people know about that, is the first bullet point here. If a group has 40% participation, 40% or more, between 40 and 50, if they dual option a Preventive Plus plan and a PPO plan, they'll get employer-sponsored rates, even if they don't hit that 50%. So that's something to consider if you have a group that's right on the verge of hitting 50% participation. If you add that plan in as a base plan, even if nobody enrolls in it, you'll get the employer-sponsored rates. Like I said, we only look at participation as a qualifier, not funding. And as I mentioned, I keep going through my presentation before I get to the slide. Members cannot self-fund 2 preventive visits for less than their annual premium. So, a lot of times when you're spreadsheeting dental, you'll see, the preventive, basic, and major services, orthodontia, deductible, calendar year max, and maybe whether the group has UNC or MAC coverage. Something to think about, when it's missing. I know a lot of dental carriers offer rollover. And in theory, rollover sounds great, right? But there's a lot of downsides to it because the members have to wait to use it. They have to build up their amount that's rolling over. There's no, first year usage. There's nothing built in if something unexpected happens. So something to consider when you're quoting dental, think about Humana, think about that extended annual max that's built in, and then think about the wellness aspect, right? The periodontal cleanings, the preventive cleanings. Think about those as differentiators. Although they might not show up on your spreadsheet, they really are worth a lot. And to combine in our, fantastic rates and national network, it's a slam dunk. With that, I kind of blitzed through that dental. You guys were so quiet. I'm going to see if there's any dental questions, and if not, I will move on to vision. All right. So moving on to vision. So what are employers facing, right? Especially now more than ever, digital eye strain is real, right? We are all at our computers all day. We're not out yet, or maybe, just newly are getting out of our office. We're not staring at screens all day. We want employers to invest in eye health because without it, they're going to lose productivity, right? If their team is constantly having headaches and eye strain and having to go to the doctor, they're going to lose the productivity that they're desiring from their employees. So right now, we have over 2.1 million commercial vision members. We've been selling vision for over 50 years. And, like I mentioned during dental, people a lot of times just see Humana as a medical player. And, I just can't emphasize enough how strongly our presence is in the specialty market, but how much of an emphasis internally there is to grow. So again, we have a national network. We have an extensive lab network. We have really cool and unique online shopping for both contacts and glasses, which again, I think is important now more than ever because COVID, right? We're not leaving our houses unless we have to. So to have that option to, order glasses with your insurance discounts online, I think is a big differentiator. Again, there's a lot more to vision insurance and eye exams than just, getting glasses or contacts. We can diagnose brain tumors, high blood pressure, diabetes, stroke, MS, and again, rheumatoid arthritis. A lot of these things, and not all, and it doesn't happen often, right? but it can happen from a vision exam. And, you know, our vision premiums are $6-ish, give or take, per employee per month. You know, pretty minimal cost to have, you know, some, I think, peace of mind. You know, when you get your eyes checked, you know that they can see a lot of these things. We have 3 different platforms of vision plans. So we have an exam-only coverage. We have 5, actually now, full coverage plans. We've brought back that Humana Vision 150 because that was so popular. And then we had material-only plans. As you know, we have 2-year rate guarantee standard on all vision plans. And we have broad network access. We have 75,000 providers nationally, and we're continuing to grow that that number. So if you are quoting Humana and there's a certain provider that, you know, you're not seeing in network, reach out to your team at Health Plan Services or reach out to Amy or I. We're constantly contracting new providers. So, you know, don't ever feel or don't ever let, you know, a provider be a deal breaker because a lot of times we can make those contracts happen. Again, just like the dental, we want to make it affordable, broaden coverage, improve well-being, and encourage utilization. You know, I think one of the biggest differences with our vision plans and what's missing from a lot of spreadsheets are the progressive lenses and the anti-reflective coating. With Humana, you will always see a set price, right? So I've noticed with a lot of other carriers when I'm looking at you know, their plan summaries and doing comparisons, a lot of times it's just X% off. Well, that percent, what does that mean, right? Percent off of what? 20% of 800 or 20% of 80? It's a pretty, you know, big swing. So with Humana, we have fixed costs. So there's a lot of predictability when you're going to get glasses. So you can kind of, you know, budget and figure out what you're going to pay before you're there paying it. So I just want to show you quickly how Humana Vision works. So you can see on here, like this is our Vision 200. So this is a rich plan, but if you have, you know, groups that really utilize vision insurance, this is the way to go for sure because the savings are substantial. There's a $0 exam copay on this plan, $0 lens copay. There is a progressive lens copay for $70, and then you'll see the anti-reflective coating on there. So with vision insurance or with our Humana Vision 200, this would cost one of our members $103. Without the insurance, it would cost $809. Substantial savings, and I think this plan runs give or take around $9. The really cool thing about Humana Vision plans is that we have a rate card for groups under 100. So, you know, when you're presenting to a group and you may or may not have your Humana Vision quote handy, we've got a rate card that you can have access to so you can talk to those employers and let them know exactly what the cost would be. And, you know, it's so minimal that it's, I think, you know, a pretty easy add-on because, you know, who doesn't want to, you know, when employers offer additional benefits like dental and vision, they're attracting their employees and they're keeping them happy and they're keeping them there. So I think when they see the minimal cost to add on vision, you know, 9 times out of 10, they're going to decide to go that route. Again, with vision, the participation or the employer-sponsored or voluntary rate is based on participation, right? So 50% is that magic number for us, and that's after waivers. So if you've got a group of 40 and you have 10 valid waivers that are, you know, on their spouse's coverage, you only need 15 people to get that employer-sponsored rate. So we make it really doable, I think. So, you know, really encourage utilization because, you know, the rates go up, I would say 15% to add that voluntary rider. So, you know, getting employer-sponsored when you can is certainly the more economical way to go. You know, like I mentioned, we have 75,000 providers. You can see a lot of our big name companies that we're contracted with on the bottom, but we also have, you know, several mom and pop type optometrists. So again, let us know if there's somebody you want contracted that isn't, but in the meantime, you know, you've got those big names down there for pretty much anywhere you go.